How does taking an HIV test help me?
If your test result is positive, you can take medicine to treat the virus. HIV treatment reduces the amount of HIV in your blood. Taking HIV treatment as prescribed can make the viral load so low that a test can't detect it, or undetectable viral load. Getting and keeping an undetectable viral load is the best way to stay healthy and protect others. If your test result is negative, you can take actions to prevent HIV. Knowing your HIV status gives you powerful information to keep you and your partner healthy.
Should I get tested for HIV?
Centers for Disease Control and Prevention recommends everyone between the ages of 13 and 64 get tested for HIV at least once. People with certain risk factors should get tested more often. You should get tested at least once a year if you're a man who has had sex with another man. You've had anal or vaginal sex with someone who has HIV. You've had more than one sex partner since your last HIV test. You've shared needles, syringes, or other drug injection equipment. You've exchanged sex for drugs or money. You've been diagnosed with or treated for another sexually transmitted disease. You've been diagnosed with or treated for hepatitis or tuberculosis. You've had sex with someone who has done anything listed above, or with someone whose sexual history you don't know. Before having sex for the first time with a new partner, talk about your sexual and drug use history, disclose your HIV status, and consider getting tested for HIV together.
If I'm a sexually active gay or bisexual man, how often should I get tested?
If you're a sexually active gay or bisexual man, you may benefit from more frequent testing, like every 3 to 6 months. Talk to your healthcare provider about your risk factors and what testing options are available to you.
Should I get tested if I'm pregnant?
All pregnant women should get tested for HIV so they can take steps to stay healthy and protect their baby. Testing pregnant women for HIV and treating those who have HIV has decreased the number of babies born with HIV. HIV treatment is most effective when started as early as possible during a pregnancy. However, there are still great health benefits to beginning treatment even during labor or shortly after the baby is born. If a pregnant woman gets HIV treatment early in their pregnancy, the risk of transmitting HIV to their baby is extremely low, like 1% or less. Pregnant women who test negative for HIV can talk to their healthcare provider about taking PrEP, pre-exposure prophylaxis, to prevent HIV.
Should I get tested for HIV if I don't have any risk factors?
Centers for Disease Control and Prevention recommends that everyone between the ages of 13 and 64 get tested for HIV at least once as part of routine healthcare, and more often if you do things that might increase your chance of getting HIV. Even if both you and your partner are having sex only with each other, you should both find out your HIV status.
What should I expect when I go in for an HIV test?
Your experience may be different depending on the setting. If you get an HIV test in a healthcare setting or lab, the healthcare provider will take a sample of blood or oral fluid. With a rapid test, you may be able to wait for the results. With a lab test, it may take several days for your results to be available. Your healthcare provider may talk with you about your risk factors, answer any questions you might have, and discuss next steps. If you are tested outside of a healthcare setting or a lab, you will likely receive a rapid test. The counselor providing the test should be able to answer questions and provide referrals for follow-up testing, if needed.